All right, guys. Thank you for joining Connect Care Network. This is CCN. This is Consumers Doctor, Dr. Bengala. Health disclosure, healthy pricing, healthcare premium with health solutions advantage. Today, let's talk about health HDSP HSA, hdhphsa.com. Stands for Health Disclosure Healthcare Premium with Health Solutions Advantage. Our main focus is today freedom in healthcare. We are shackled with several rules and regulations in healthcare. I would like all Americans to get the access to healthcare, and they could be free and make the decisions accordingly how to access the healthcare. Uh, as a consumer, there are three things which are very important for all the consumers. One is the cost, second one is the coverage, third one is out of pocket expenses. Out of pocket expenses. All consumers, if you're listening, you really need to connect with CCN Connect Care Network along with HDHP HSA, Health Disclosure Healthcare Premium with Health Solutions Advantage. Let me explain to you how this works. HDHP is a deductible plan. I renamed it as Health Disclosure and Healthcare Premium or Healthy Premium. Basing on your health, your premiums are disclosed, and your premiums obviously have to be lower. When they are lower, you can save money, put aside into Health Solutions Advantage, or you can call Health Savings. It's also an HSA. What I see is a lot of people look at it. How could you be? How could you provide? How can you set up this HDHP accounts? There are several insurance companies. They have these HDHP accounts, and most of them. It doesn't matter where you stand. You could be independent. You could be working for a small company, or you could be work for you could be in a big company with several employees, and you could be on Medicare, you could be on impaired, you could also be an impaired group. I'll give you the basic fundamental, folks. What I see here is one thing good it has done, the ACA, Affordable Care Act, so-called Obamacare. One thing it has given, there's a benefit from the ACA. What we got is there are five fundamentals we need to embrace from the ACA. What the ACA does, it's guaranteed health insurance, number one, guaranteed health insurance. And number two, pre-existing coverage, illness, pre-existing coverage, coverage for the pre-existing illnesses. And number three, transition from the parental to an individual. Suppose if you are 26 years old, up to age of 26, you could be covered by your parents' policy. But after that, you have to have an individual policy. And number four is unlimited lifetime maximum. You really need to have, whenever you're getting a policy, you need to have unlimited lifetime maximum. And number 5, comprehensive major medical. Comprehensive major medical, which is essential, and I would like everybody to have comprehensive major medical. So these 5 elements we need to embrace in the HTHP HSA coverages. HTHP, which is a deductible plan, I renamed it as Health Disclosure Healthcare Premium. It's a matter of personal responsibility. If you're healthy, your premiums are lower. If you have chronic illness, your premiums, you come in a different category. And if you have at risk, you're a different category. And these are the things. Their premiums are based on which category you belong to. Generally, let me talk about the insurance. Insurance in general, what it is, risk is spread it out across the pool. What I'm trying to do is the we everybody should not be in the general risk pool. Risk needs to be segmented, folks, because that's one of the reasons why we are not able to control the cost of the healthcare. What I would like to see is risk needs to be segmented. This is a beauty, where by segmenting the risk, you're categorizing to 4 different categories. By doing that, let me tell you what these categories are. Number 1 is catastrophic illness. Catastrophic illness, you will never know a person gets, sick or undergoes emergency surgery. You need to be covered for that. That's number 1. The claims in the catastrophic segment are less than 1%, folks. We don't need to expose the entire population. What I'm trying to is by segmenting the risk, you're focusing only on the level 1 category, and your premiums have to be based on catastrophic illness. And number 2, at risk. At risk, there are 20% of the population are at risk, and the claims are roughly around 20%. What I'm saying is, when people have, people like smokers or people with hypertension, diabetes, you need early intervention. And your premiums can be lowered by educating this category. And roughly the 20% of the folks have at risk, exposed to at risk, but the coverage, the claims are only 20%, but we don't need to again expose the entire population. We don't need to raise the premiums and rest of the category. And number 3 is chronic illnesses. Only 16% of the population have chronic illnesses. And this is where the maximum claims are. 41% of the claims are from the chronic illness. So even there, you can lower the premium by embracing technology, telehealth, telemedicine. You name it. If somebody has hypertension, they could be monitored with a nurse practitioner, whatever, through telehealth. They don't need to go to the doctor or clinic. They could be monitored at home through telehealth or telemedicine. This is where the technology is going to help us lower the cost, and the premiums can be lowered ultimately. So these chronic illnesses, the one where the claims are over 41%. This is their main focus, and people with chronic illnesses have to be in a separate category. and their premiums are different. Their premiums are a little higher, but they can still save money put aside into the Health Solutions Advantage or HSA. Then the last fourth category is well category. 63% of the population, 63% of the population are in well category. Claims are less than 12% in the sense it's actually it's less than 1%. The claims are less than 1%. So what you're doing is people in the well category, the premiums have to be lower because you know they're healthy, they don't have any chronic condition, they're not exposed to any risk, and and their premiums have to be lower. So they can put money aside into the health solutions, HSAs advantage. So that could be used. If I'll give you a scenario. If a person works for a large company and you can go to the human resource and get the information and participate in the HDHP accounts where the premiums are lowered because of the deductibility factor, then money saved is put into the either the HRA or HSA. HRA is controlled by the employer. HSA is you, the consumer, controls it and you take care of it and you manage it. This also benefits the employer, folks. Believe it or not, employer also has a big tax write-off by giving the employees the HDHP accounts. I would like to see it needs to be educated. So a lot of people don't understand how this health savings works, health so-called health savings or health solutions advantage. How does it work? This is the way it is. The premiums, if you're an individual, you can set aside every month, up to $300, maximum up to $300 every month. If you're a family of four, you can put $700 for a family of four. You still have a employer subsidized health insurance with a deductibility. First year it will be guaranteed by the employer, but subsequent years you take the responsibility and basically you put aside the savings for the future use. There are a lot of benefits with the health solutions advantage or HSA or health savings account. There is a triple advantage. One, the contributions, what you're making, are not taxable. They're not taxable. You can write off in your taxes. And employer, when he contributes it, for employer also, is not taxable. And number two, the account which is invested in the market, in the sense you can have a health solutions advantage account set aside either in Fidelity, HSA, or any brokerage firm. You can set up an HSA. And foremost organization, so-called HDHP HSA, will help you facilitate set up an HSA account separately where you can put money aside. And number three, withdrawals are not taxable. If you take the money out for a health reason, it's not taxable. So there's a triple benefit, folks. This has more benefits than regular Roth IRA or SEP IRA or any other investments. So I encourage everyone to participate in this plan, where it benefits the employer and employee and people who are in the I'm talking about this Medicare, people on Medicare, people on veterans, they could participate. Again, the laws need to be changed. Right now, what the Medicare is doing is they're delegating into the intermediaries. I wish the CMS, Center for Medicare, CMS or HHS, they realize instead of giving it to the intermediaries, I wish they can delegate it to each Medicare recipient to handle themselves. If they can do that, what an individual American who is an AARP member, they have 10 options to choose from, 5 to 10 options. Whichever premium is lower, you automatically the payments go into that, and whatever you're saving is put aside into the health savings. I wish the Medicare does the same thing, like a regular HTHP account with NHSA. Americans can do a better job of, once these intermediaries get these funds, very first thing they do is even though you see so many ads coming up, Medicare Advantage, Medicare this, Medicare, you'll have a free dental, free eye checkup, free this, free. It's not free. Come on, folks. They are taking the funds from the Medicare and they are marketing it for you to join them. But if you have a Medicare supplemental, if you have an HSA account, you really don't need these intermediaries. People who can afford to have a supplemental policy, they can use the funds from the health solutions, HSA, to pay for it. You don't have any out of pocket expenses once you set up an HSA. HSA is something where you can withdraw the funds, pay for the medications, pay for surgeries. Normally Medicare pays 80%. We are responsible for 20%. By having health solutions advantage or HSA, you come out ahead and you basically have the freedom to choose your doctor, freedom to go to any facility you want, freedom to buy any medications. So consumers are in the driver's seat. Even AARP member are in the driver's seat. That's what I've been trying. Right now, Medicare doesn't let you do that. Medicare does not let you have contribute to the HSA, but things are going to change. Ultimately, things Medicare is not going to be solvent, folks. Down the line, Medicare is going to be insolvent unless they come up with. They need to get rid of these intermediaries where they're taking the money out and restricting the care. Once you join the intermediaries, there is no choice. Then their co-pays, deductibles, and and restrictions on seeing so many doctors or facilities that you have very little freedom. This is what I've been talking about. If you want to be free and make a choice in healthcare, this is the way to go, folks. Join the HTHP HSA, which is Health Disclosure Healthcare Premium, along with Health Solutions Advantage. There are a lot of benefits by doing that. Risk segmentation. I wish the insurance companies embrace that. And we need to have transparency in premiums. Right now, there's no transparency. Right now, there's no transparency in the premiums, what you pay. So I would like to see finally everybody embrace HTHP accounts with HSA. And that gives you an option to choose your own doctor, choose your own facility, choose your wherever you want to go, and you have all the access in different aspects of healthcare, even ambulance. You can use the transportation for, or you can, whatever the transportation to go to the hospital for emergencies, you can use those funds from the HSA. Folks, I would like to get some input, and at some point I should be able to see the chat box so I can respond, I can address everybody's concerns. This is my first, I've been trying to stream. This is the first time I'm able to stream. So hopefully I'll continue to do this every day, try to educate the public. This is Foremost organization is a non-profit entity, folks, which is also the DBA's HDHP HSA, which is high deductible health plan, renamed it as health disclosure healthcare premium with health solutions advantage, otherwise called health savings accounts, folks. So make some comments, hit the subscription button if you want to learn more about it. Join me in the next episode of CCN, Connect Care Network, CCN channel. This is Consumers Doctor, Dr. Bengal. Thanks again, and I'll see you in the next episode.